Stroke or lakhwa or paralysis all mean the same, and strokes can happen because of two different mechanisms. One, when you get less blood supply to the brain, or when there is bleeding inside the brain. The most common is usually less blood supply to the brain. Whatever is the cause, it's very easy to pick up a stroke symptom, and you can do this by remembering the acronym FAS. And what F stands for? Whenever you see anyone with a facial asymmetry or a facial drooping suspected stroke, whenever you see someone with an arm weakness, or whenever one arm starts drooping as compared to the other arm when you keep them outstretched in front of you, that's a sign of a stroke. Or if there is a S, that is a change in speech, then that's the time when you say that it's got a stroke. And if you have any of these three symptoms, then it is time to do what is called T, time to act. And you should act fast, because the earlier you reach the hospital, you can get the patient treated in what is called as the golden window period, which should be usually in the first 3 or maximum 4.5 hours. And this treatment has to be done in a CT ready, a stroke ready hospital. So it is your duty to identify this FAS symptoms of stroke and rush the patient immediately to the nearby hospital. So stroke, the one which is because of less blood supply to the brain, has got a lot of treatment options, but the patient has to reach a stroke ready hospital in the first 3 or 4.5 hours. If he reaches in this window period, we usually give them a blood thinning injection which is called recombinant tissue plasminogen activator. It's given as an intravenous injection over a period of 1 hour, or there is a newer version which is available as injection tenecteplase, where we can give over as a rapid shot of injection. Both these injections actually help to lyse the clot, and in good 30 to 40% of patients do very well. Even in the remaining patients who have received the injections, at the end of 2 or 3 months, these patients tend to be much better as compared to those patients who have not received this injection. I am again and again talking about this time duration because time is of paramount importance in stroke. If you miss this golden period and if you reach the hospital in the next 4.5 hours, still there are a lot of medications which we can use for you. These are basically blood thinners, cholesterol lowering drugs, drugs to control your diabetes and blood pressure. But these are drugs which tend to act very slow, and the patient tends to recover slowly. In those where the stroke has happened because of bleeding inside the brain, majority of them do well with only control of blood pressure. However, if the bleed increases or if there is swelling inside the brain, they may rarely need surgery also. Once the patient gets all these medications, right from the second day, they are started on physiotherapy. They are tried to be started on a speech therapy regimen, and both these therapies go a long way in helping the patient go back to his normal life. A majority of the patients, about 70 to 90% of the patients who suffer from stroke, if they are in the window period in the hospital, usually tend to do well and can go back to their normal activities. After you get a stroke, in the hospital itself a speech therapy and a limb physiotherapy is initiated, and this should continue once you go home also. So what care do you need to take of these stroke patients at home is you need to constantly encourage them. You need to keep speaking to them, try and make them speak things, try and make them read things, and at the same time you have to encourage them to use their hands and legs for day-to-day activities. Obviously you have to remember that they are weak on that side, but the more you use the weaker side, the more the brain is going to respond in terms of formation of new neurons, and this will ultimately lead to a very good and meaningful recovery in most of these patients. So physiotherapy and speech therapy, along with good motivation from all the caregivers, will give a good result for all patients with stroke.